I joined the Army for money for college, and I only intended to do maybe 3 years, my initial enlistment as a private. As I was getting towards the end of that time period, I realized that the Army had quite a bit to offer. There are a number of opportunities to do good things for people, humanitarian efforts, and then two, there are a number of educational opportunities. I have a baccalaureate degree from the University of South Carolina in Business Administration. I have an MA in Management from Bowie State University, an MBA from Troy State University, and my PhD is from the University of Alabama at Birmingham. One interesting thing about the Army is that you'll change assignments anywhere from 18 months to roughly every 2 years. I actually began my career at Fort Meade, Maryland, in the 85th Medical Battalion. That's the unit I went into combat with during the first Gulf War. Then I came back and have been assigned in Texas and again in Germany, Georgia, here in Alabama. It does put a bit of a strain on the family and a bit of a strain on an individual's way of life, but it's definitely exciting, and you get a wide range of opportunities that you ordinarily probably would not have. We are becoming more in line with what civilian healthcare organizations consider to be important, i.e. financial and fiscal responsibility in terms of accountability and performance-based budgeting. Is just a few examples. We are definitely being required to cover our costs, and in some cases are required to not so much generate a profit, but to generate a certain degree or a level of revenue that I'd say about 5 to 7 years ago was less of a concern. Many of our soldiers are actually in combat roles, and those positions are now being filled by civilians. My facility here is largely a civilian facility. There are a few military, but roughly 70% of the staff members here are civilian staff members. Many of my key managers and leaders are civilians. What I look for in terms of a healthcare leader or a healthcare manager is someone who knows how to think and decide and act, and doesn't have to be told what to think, decide, and act. The most challenging aspect of being a healthcare administrator, I think, is balancing the business of healthcare and the care of healthcare. I would tell any young healthcare administrator that's coming in is to, again, be flexible and look at what's going on in the civilian sector. You have to be attuned to what's going on in the civilian sector of healthcare management to be on the cutting edge in the Army. One of the significant advantages of being a soldier is that you can retire at a relatively young age. I joined the Army at 17 as an enlisted soldier, became a commissioned officer shortly thereafter, a few years thereafter, and right now 39, and I'll be able to retire in about 2.5 years, which gives me the opportunity to then to pursue a second career in healthcare, as a healthcare executive, as a researcher, as a consultant, or even as a faculty member, teaching at a college or university.
This program is brought to you by the American College of Healthcare Executives, an international professional society of more than 30,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. The leaders of the featured hospitals and health systems are board certified in healthcare management, having become fellows of the American College of Healthcare Executives, signified by the FACHE credential following their names. For more information, go to ache.org.